This video is about the mental disorder schizophrenia. First, let's talk a little bit about the history of schizophrenia. I found this information from our Abnormal Psychology 3rd edition book by Deborah Biddell, Cynthia Bullock, and Melinda Stanley. It was first defined in the 1800s by a German psychiatrist, Emily Kraepelin, and a Swiss psychiatrist, Eugene Bleuler. Emil first called this disorder dementia praecox. He gave it its name by defining dementia as the perceptual and cognitive faculties, and praecox by its early life onset. He used praecox to distinguish it from dementia caused by old age. He did this so they wouldn't get confused. Bleuler viewed it a little differently by focusing on certain symptoms of this disorder. 4 of them were ambivalence, disturbances of affect, disturbances of association, and preference for fantasy over reality. He actually renamed this disorder schizophrenia, coming from the root German word schizo, meaning split, and phrenia, meaning mind. He came up with the word to emphasize the splitting of thought, affect, and behavior that occurs with this disorder. On the left is Eugene, and on the right is Emil. Schizophrenia is a severe psychological disorder characterized by disorganization in thought, perception, and behavior. People with this disorder don't perceive the world accurately or behave in ways that are normal to societies. Doctors also describe it as a type of psychosis. So on the left of this picture, you can see a normal brain. On the right is someone with schizophrenia. You can definitely see by the brain scan that our brains are different. A little bit about the prevalence of the disorder. What I found from zimdarkskin.weebly.com is this chart, and you can see from the chart that schizophrenia is definitely the most common out of these disorders. It's twice as much as Alzheimer's and 60 as much as muscular dystrophy. So it is common. But what I found from our book was that 0.3 to 1.6% of the U.S. population are diagnosed for this disease, which isn't a ton. So it is diagnosed more than others, but it's not very common. What I found from NIHS UK Choices, schizophrenia.com, was that it is most commonly diagnosed between ages 15 and 35. I also found in our book that African Americans are less likely to receive the diagnosis than white people and Latino people are, which I definitely found interesting. Some symptoms that I found also from our Abnormal Psychology book was delusions, which there are 2. Persecutory delusions, which is the most common. These consist of beliefs that someone is harming or attempting to harm them, or the belief that they are a special agent. Also, there's delusions of influence. This is the belief that others control their behavior or thoughts. For an example, they believe that the government is putting thoughts into their head, or evil forces are making them act a certain way. There's also hallucinations are a symptom. There's different types of hallucinations. Visual, which is seeing the devil or seeing dead people like your family or friends. Also, there is hearing hallucinations, which is the most common. When someone has this, they hear voices talking to them, several of them, when no one is around or there. There's also disorganized speech. One is loose associations. This is when thoughts that have little or no logical connections to the next thought. So when someone is talking a sentence, their 2 sentences don't go together. They're just not flowing. Also, thought blocking, which is unusually long pauses in their speech during conversations. There's also clang association, which is their speech involves words that sound alike rather than have meaning. So someone might use boat and coat in the same sentence, but it just doesn't make sense. There's also catatonia, which is when someone is awake but they're unresponsive to a certain stimuli. Some treatments for schizophrenia are lobotomies, which was used in the 1940s and 1950s, but the outcomes were negative. It resulted in cognitive deficits and sometimes even death, so they definitely tried to gear away from that. So then they went to hydrotherapy, which was used to calm agitated patients, which this was only a short-term cure. It wasn't a long-term, just it helped calm people. So then In the 1950s, there was a discovery of the medication chlorpromazine, which really created better results in patients. They came up with antipsychotic medications, including conventional or typical antipsychotics, which reduces positive symptoms, but it doesn't help the negative symptoms, and it has severe side effects. So that one wasn't really leaned towards. They made up a new one called atypical antipsychotics, which has less side effects, and it treats some negative symptoms as well as positive symptoms. So this was a better option. Also, cognitive behavioral therapy is used to treat it. It is also more effective when it is used early in the course of the illness. So if you catch this early on, cognitive behavioral therapy will work better. The way CBT works is they will educate the patients and family about the disorder and coping strategies to deal with the symptoms, and also ways to improve their self-esteem. And they saw some good results and outcomes from this as well. There's also some controversy about this disorder. Many people believe they have the people with this disorder have split or multiple personalities, which isn't true. Split in schizophrenia means a split between an individual's thoughts and feelings, not personalities. That's what draws the line between the disorder. Also, people think schizo is associated with violence, which is not true. The rate of violence committed by people with schizophrenia and other serious disorders are higher than the general population, but people with schizophrenia have a lower rate of violence than other patients with other serious mental disorders. So, violence isn't directly correlated with schizophrenia, but with mental disorders mostly. So, like, a person with bipolar would have higher rates of violence, which I found this from our abnormal psychology book as well. Some interesting facts that I found from schizophrenia.com/famous.htm were some famous people that have schizophrenia, and they were quite successful, like a jazz musician, Tom Harrell, a Broadway star, Mary Popkin, a Nobel Prize winner, John Nash, who's also a mathematician, and Albert Einstein's son, Edward Einstein, which I thought this was very interesting because these people are got to overcome their symptoms and disorder and become quite successful. So, I hope you thought that this video was informative and that you learned more about schizophrenia.